We use and have used the Dexta 905B surgical stool in our operating room for the past 20 years. It's a great and very comfortable operating room chair. Well, for the past 2 months, we've also been test driving the Haag-Streit Surgical Chair 900 to see if it would be a even more comfortable operating room chair for eye surgery. And importantly, we wanted to make an assessment as to whether the Haag-Streit Surgical Chair 900 was worth purchasing. And by the way, this is in no way a paid sponsorship. This is just our objective assessment of these two surgical chairs. We chose 4 criteria to compare these two chairs by: design, construction quality, comfort, and price. First, let's talk about the design. Both stools have an easy up and down movement. For the Dexta chair, there is a single large metal loop that the user pushes and pumps to elevate the chair, and then simply pushes all the way down to lower the chair. For the Haag-Streit chair, the operator pumps the rightmost lever to elevate the chair and then pushes and holds the left lever to lower the chair. Both chairs have a locking mechanism. The Dexta uses a small individual wheel lock that is part of each of the 5 wheels below the base of the stool. The Haag-Streit stool has a single central lock lever, which when pushed downward will lock all 3 wheels simultaneously, and which when pushed a second time will release the lock to all 3 wheels simultaneously. Both chairs rotate. The Dexta chair rotates both at the wheel base and at the seat base, so there are 2 rotation points for the Dexta stool. On the other hand, the Haag-Streit stool, when locked, does not rotate at the seat base, and the only way for the Haag-Streit stool to rotate is when the locking mechanism of the entire chair is not activated, and the chair rotates based on the 3 wheels at the base of the chair. The back of the Dexta stool can be raised and lowered, whereas the back of the Haag-Streit stool can be raised and lowered and then moved closer to or further from the seat of the chair. In terms of armrests, the Dexta stool has armrests. However, as you can see in these images, we have chosen to remove the armrests since they do take up considerable space and may occupy more space around the surgeon than desired. However, if a surgeon prefers the armrests, the Dexta stool does have armrests, whereas the Haag-Streit stool does not have any armrests and does not have the capacity to support armrests either. In terms of construction quality, the Dexta stool has been proven to require little to no maintenance over the 5 to 10 year span that we use each chair for. The Haag-Streit chair looks good, but since it's a newer product, it's too soon to tell how well it will perform and how much maintenance it will require in the future. The comfort of both stools is excellent. The seat cushion of the Haag-Streit stool, in my opinion, was a little bit more comfortable than the Dexta seat cushion. However, both seat cushions are very comfortable. The rotation mechanism of the Dexta stool makes it easier to use if the surgeon rotates quite a bit. On the other hand, if the surgeon prefers that the base of the chair be stable on the operating room floor and not move at all, then the Haag-Streit stool is far more stable than the Dexta stool. Once the Haag-Streit stool is locked into position, it is super stable on the floor and will not move, whereas it is not possible for the Dexta stool to remain super stable because the wheels will slide along the operating room floor despite all 5 wheels being locked simultaneously. And finally, in terms of cost, we purchased our Dexta stool for just under $2,000. The Haag-Streit stool is considerably more expensive at $5,995. So there is a significant cost difference. However, surgeon comfort and surgeon ergonomics while seated and performing thousands and thousands of cases for thousands and thousands of hours over a career is priceless. So what did we ultimately decide to do? Well, we actually did purchase the Haag-Streit stool, and we really like it. However, we only purchased one, and we will continue to compare the two stools going forward and make a decision about whether we will keep only one Haag-Streit stool in our 2 operating rooms, or if we will eventually purchase a second Haag-Streit stool in the future. So in summary, both these stools are excellent. We decided that the Haag-Streit stool was worth the cost, even though it was 3 times the cost of a Dexta stool. And if our priority is the long-term comfort of the surgeon for the thousands of hours that they invest performing surgery while seated, we do believe that the Haag-Streit stool is slightly better than the Dexta stool. I hope you found this review helpful. Thanks for watching, and I'll see you on the next video. Bye-bye.